So today we are going to discuss about the basic nursing issues in our palliative setup. You must have seen many problems so far in the patients, right? So can you name one or two problems what you are facing? You can write down in chat box. Okay, so many of our patients would be bedridden. They may be having problems in their intake, maybe having problems in their bowel movements. Some may not be able to sleep adequately. Movement problems are always there. Reasons may be plenty. Their behavior also changes when they become maybe because of their disease condition or any metabolic changes or age-related problems and others. Somebody may be at the deathbed, right, and passing their last few hours. So as nurses, we do have to deal with many of these patients, and we need to educate the caretakers also how they can maximize the comfort zone of the patients. Many times it may be very difficult, very tedious task. Always we may not get the result what we want, so we become discouraged also. Patients' relatives also may get discouraged. All this affects the caretaker's health also, right? Apart from the patient himself or herself. So let us take these problems one by one. Many of the care points we might be knowing, we might have been doing also. Then also we may learn one or two extra points, some new points may be there. So we will share what knowledge we have with one another. So that's the main aim of this session. So let us start with the skin care. A very basic thing to look after when the patient is completely bedridden or patient is not able to take bath himself or herself. So what to do? The sole purpose of this will be, we of course have to see what are the purposes behind this care in our patient. So accordingly, many times we have to modify the method and other things. Right? So first we will see the purpose. We know that it will clean the skin and give refreshing feeling to the patient. It will help in stimulating circulation, so we can prevent bed sore to occur. Right? It will also help in elimination through skin by opening up of pores. Right? It will also regulate the temperature, and of course it will relieve fatigue and induce good sleep also, which is very essential for our patients. And of course, sense of well-being will always be enhanced. There are many other purposes, but looking at this, we can focus on these things. So what will we remember? Always, many times this first point is missing, providing privacy. whether the patient is conscious or not. Always this should be our first point. So putting maybe at home, if possible, close the door or keep the sari, keep the chairs, whatever, right? So screen the surrounding is very essential. Whenever possible, we need to give information regarding the procedure, because in the beginning, no one would like to take bath from others, right? So we need to explain why it is essential. Then slowly the patient may get accustomed to bed bath. So initial days are very, very important, when they may show some uh, not liking feeling, right? So that should be accustomed to, and we need to explain them. All the equipments, whatever are essential, should be collected first at the bedside and then start the procedure. That is very essential. It Many times this may be very convenient in our hospital setting, but when we are doing the procedure at home, many times it is forgotten. So caretakers also need to be told accordingly, taught accordingly. Temperature of water, of course, it should be adjusted as per the comfort of the patient, right? And it should be seen that the caretaker doesn't harm her own back. So where to keep the patient, how to bring the patient near the caretaker, that should be uh, told or taught to the caretaker. That is very essential, because most of the times it is the caretaker who will be taking care of the patient. And most of our patients would like to be at home rather than in the hospital. So such things should be kept in mind. And only necessary area, necessary body part should be exposed. Removal of soap is very, very essential, because otherwise, if the soap will remain on the skin, it will give irritation to the skin, and also it will dry the skin further. So person may be now prone to bed sore, right? So that should be seen. How to move from one part to another, that should be also taught to the relative, and why it is necessary. Yeah, so that also the principles behind doing so, behind moving from one part to another, that should be taught to the caretaker. Rubbing of the skin or drying of the skin by rubbing is not should not be done, because it will harm the skin, because our patients will have very fragile skin, and the skin will easily chap off. So that should be seen. How to do nail care, how to take care of the feet, more dirty area, how to attend, that also needed to be taught to the relatives. And thorough inspection, whenever the person is moved from one position to another, thorough examination, and especially detailed examination at the time of giving sponge bath is very, very essential. In palliative care, we always see to it that the skin remain moisturized. Okay? And for that, we don't use the talcum powder. That must be remembered. In palliative care, we use instead moisturizer. Sometimes we may wonder that how it is possible to use moisturizer in such hot season, right? So amount of it will vary, of course, and moisturizer should be applied immediately after giving bath, so that it will spread very easily and equally to all the body parts. So that should be seen. And at home, it is advised that the moisturizers which are very easily available, such things should be advised, like oil, coconut oil, any edible oil can be applied. Right? So as per the patient's condition, it should be seen that these are advised. So not to go for any fancy things, and also very mild smell. Okay, so perfume also should not be very strong because that can also create further problems. So we advise to use most of the times about coconut oil or Vaseline. We know the bed sore points, right? When the patient is in different positions. So ideally, it should be seen that patient's position is changed every 2 hourly during daytime. Yes, and all the pressure points should be padded. So you can use extra pillows, and if it is not available, then we can use soft clothes. So that also is quite okay to use soft clothes, okay? Especially when the patient is in lying down, side lying position, say for example, and you need to place a pillow in between the knee joint. Okay, so instead of that, they can place soft cloth. Okay, so in that way also pad can be created. We try to avoid donut shape equipments, right? Because that many times causes venous stasis, so and can lead to ulcer. Right? So what is ideally is to use soft clothes. And during night, what to do? So during night, when we want to give a glass of water or like that, patient may get up once in a night. So at that time, position can be changed, not to wake up patient every 2 hourly during night, because it is very essential for patient to take good sleep. Now, what if the patient is in wheelchair or patient is keeping sitting for longer period of time? So there also, there are pressure points you can see in the right side of figure, right? So in them also, we need to first place some padding at the uh, bony prominences. Okay, and here also patient need to move a bit. Okay, so some movement every 15 minutes will be very good, so that it will not cause direct pressure in the area, and the part will have adequate blood circulation. Sometimes we may find it difficult, especially when the patient himself is not able to move. Right? So at that time, one has to be more watchful. Further, we have to remember and tell the patient's relative that avoid the pressure points to be massaged. Okay, so otherwise it will cause more damage, and never to massage when the person has already developed pressure sore at one point. Okay, so over that one should not massage. Further, passive stretching of each joint is very essential. This will prevent atrophy of muscles, and also it will prevent contracture and development of deep vein thrombosis. Okay, so at least twice a day, all the joints should be stretched. This can be passive stretching or active stretching, depending on patient's condition. Uh, Two remaining point positioning of pillows and prominences we have already discussed. There are certain devices available like air mattress and water beds, right? But that is not the final solution. Many times these things are available in hospital, but at home, what to do? Of course, nowadays many NGOs are there who provide this, and the equipments also have become bit cheap. So many patients, they can afford also. They should always be told that it is not the final solution, and always there should be leaking of air and water should be checked. Right? This will help in spreading the weight equally. Only that is the good point, but all the other points, how to take care of the pressure points, that remains as it is. So one needs to continue the care of the pressure points. Identify at-risk patients who can develop bed sore. Okay, so that risk list should always be with us when we are doing assessment. Okay, so that we can identify and we can advise the caretakers. Uh, all the preventive measures, right? All three important points like avoiding of pressure, then avoiding of shear force and friction, that should always be taught to the person, uh, how to avoid them. And if by chance, what to do when the pressure sore occurs, right? So that we have already seen those points, how to take care of the pressure sores. Okay. Few important points are given here, that cleaning and irrigation with help of the normal saline, regular dressing of it, stage the bed sore, and find out if there is any secondary infection into it. Right? So for that, we need to do inspection regularly. What happens when good oral care is not taken by the patient, or when the patient is not able to do, it is not given to the by the caretaker. Right? There are plenty of the problems which can lead to major complications also. Right? So our purposes behind this care is that you keep the condition of mouth very healthy, right? So in mouth, there may be problems of teeth, gums, and lips, right? So we need to give attention to all these, all the parts of oral cavity. Uh, how to clean food particles, how to remove plaque, and not allowing bacteria to grow, that all is essential. It will also help in stimulating appetite, which is essential for our palliative care patients because they might have reduced appetite. Uh, of course, it will improve the sense of well-being. Massaging of gums will be there, and it will also relieve discomfort because of the bad odor and taste. So patient will like to eat more, and it will also help in digestion. So that is very essential. So in palliative care patients, who all are the patients who will require good care of their mouth? So our patients may be terminally ill patients, there can be post-operative patients also, yeah? Patients who have diseases and infections in the mouth, uh, patients who are on NG tube feeding, they also require regular care. Uh, then unconscious patients will also be requiring this good oral hygiene. And of course, the patients who are mouth breathers, right, having breathing difficulty. So they all will also require good care. So what are the materials that we use? Commonly used materials are like good toothpaste or tooth powder. Uh, Person can use even salt also, right? That can be neem stick also, right? Soda bicarb also, right? Lime juice and glycerin also. Right? So depending, there are certain solutions also which are used for mouth care. Right? So as per the condition of the patient, financial availability of the patient, they should be used. Commonly used other solutions are potassium permanganate, you know the strength, hydrogen peroxide in the case of hospital patients, and of course normal saline that can be used very easily at home also. Right? And many times it is very beneficial also to use normal saline. So that should be advised. How to make normal saline at home, that also should be told. So at no extra cost, the patient can manage good oral hygiene. What about the emollients? So here again, we can ask patient to use oil or glycerin, right, or Vaseline, whatever is available. Many times just cream of the milk, that also is good enough. Okay, so as per the patient's condition, we can advise what to watch out. These things are very, very important. So caretakers are also advised how to do, what to do, and what to watch. So that is very, very essential. Any loose tooth which can become foreign body for our respiratory tract, right? Then dentures. Dentures, when the person is using, care of dentures is also very essential. Just like real teeth, they should be taken care of. Otherwise, they will start giving problems. Any cracked lips, what to do? If the person is having coated tongue, whether the person is having any fungal infection, right? Any curd-like patches are there or not. All this will affect patient's appetite also. So that should be watched. Whenever the person is complaining that the relative is complaining that patient is not eating food enough, right? So not to forget to ask patient to open his mouth and do thorough examination. Many times patients do have ulcers in mouth, right? Any redness, any bleeding, whether patient is having any medication history, because there are medications when they are taken for long period of time, they create oral ulcers and fungal infections. Uh, whether the patient is having any pain, patient is having any dysphagia or change in the taste of food, why it is occurring, always need to ask this question, why it is happening. Then we will surely find out the reason, and we can give good care to the patient. So this thing are always remembered. There are many oral problems, like one most common is halitosis. What can be the causes? Or that can be dietary cause also. Sometimes use of garlic and spices also create problem, right? Apart from other things like GI problems, any obstruction, any infection of lungs, right? So in them also there may be halitosis problem. So what to do? Some non-pharmacological interventions, right? Give good oral hygiene, that is must, right? Use of metronidazole gargles. So here we can place 3 to 4 drops in a glass of water and ask the patient to do gargles with it. It works wonders. We can use soda bicarb powder also, right? Or make the paste of it and give care. And of course, mouthwashes are available, so that can also be used. Dentures, when they are used, they should be cleaned thoroughly and soaked. Adequate food intake is also essential. Whether patient is having good saliva production or not, that is also essential. So we need to ask such questions also. So what other things in pharmacological management? So it will depend on the cause. Okay, so we can use metronidazole and metoclopramide also. So these things will help. Other health problems, whether the patient is having increased secretions, right? So at that time, we can use 3 to 4 drops of atropine eye drops sublingually, 2 to 3 times a day. So that will help in reducing this salivation, excess salivation. If the patient is having oral candidiasis, then of course topical application of nystatin will also help. And for the prevention of it, we need to give oral care regularly. Person may tell you that the taste is sensation has changed. Okay? There may be reduction. There are different terminologies. Okay? So identify the causes why they are occurring, whether any distortion is there or absence of taste is there. Right? So we need to identify the causes, right? Whether it is xerostomia or some drugs are used. Many times the treatment drugs which are used for cancer, they also can lead to this. Okay, so we have to identify the causes. Person can have zinc deficiency also, right? Especially in the cases of malignancy. So we need to give supplements in them. Many times person can suck over ice candies, make ice candies at home, and maybe with some juice, lemon juice or pineapple juice like that, and they can suck them, so that will help in such conditions. Chewing gum also will help. A piece of pineapple can also help in the fungal ulcers also, fungal infection, and it will also increase salivation. Health education is very essential and it should be given as and when required to the relatives. It also should be remembered that whenever the relatives are doing care of the patient, they should be encouraged. Okay? So always encourage, because they are 24/7 with the patients. So always encourage them and appreciate them, whatever they are doing for the patient. So that will help them to rejuvenate and do better care of the patient. So that should be always remembered. So this is the thing when the patient is dependent, how to go about it, right? So all this we know, right? It is just for the revision sake. Some pictures are shown, some points, important points are written, right? In what position patient should be kept, what we should remember, that not to give gargles when patient is unconscious, right? Position of the head is very essential. Draining of the fluid, patient should not be given gargles for when they are not able to spit it out, right? Because we don't want any aspiration pneumonia, not to create more problems for the patient. So all those points should be remembered. Okay, so this is encouraging patient to rinse mouth frequently. So for that, normal saline can be used, right? And other simple water can also be used, especially before food and after food. That will help in patients' salivation, good salivation, and keeping the mouth clean. When patient is having any problem, any chapped lips or mouth ulcers, angle of the mouth, some fissures are there. So special attention should be given to these areas also. And of course, not to forget about the documentation when the patient is admitted under our care, that what you observe during the patient's care. Certain things can be used at home especially when the patient is unconscious. Okay, so it becomes very difficult to give care to them. Right. So here you can see that simple spoon is used, the handle of the spoon. Okay, and what is done here is you have to wrap the spoon handle with the help of the gauze piece. Right? Now, gauze piece may not be available all the time. So at that time, patient relative can use cloth piece also. But things should be remembered that the threads of the cloth should not be loose so that it will go in the respiratory tract and create problem. And one side should be in our hand so that the cloth doesn't go in, right? So that's how we can give mouth care to the unconscious patient. So how to do it? It is shown clearly shown in the picture. How to give hair care? So our purpose is not to just clean and keep the hair healthy, but also good growth and to prevent loss of hair, prevent tangles happening, prevent any infection taking place in scalp, any itching, all these things also we need to prevent. Uh, and it will of course stimulate good circulation in the head. So that is also very essential. And all uh, of us, whether it is a lady or a gents person, all we love our hair. Right? So, and it is a part of beauty, right? So when we give care, this should be always remembered that well-groomed person uh, always feel better. So while we are giving hair wash, what to remember? Again, we have to remember the sequence and where to put the head, how not to make the bed wet. That is very essential. At home, it becomes very difficult many a times because we hardly imagine giving care, washing hair at home. Right? And now the relative has to do it for the patient. So one has to be taught nicely how to go about it, how not to wet the bed, and also that the soap should not enter in the eyes, not in the ears. All those points should be remembered and taught to the relative. After wash, drying should not be forgotten, right? Otherwise, the patient can catch up cold and cough, right? And of course, combing nicely and gently also while removing tangles. Oil massage should be done, and if long hair are there, then they should be neatly combed in two plaits. Many times we like to chop off the hair, right? But the patient, how the patient will feel, right? She wanted long hair all through her life. She had long hair, and one fine day we want to cut her hair just because we are tired of taking care of it, right? So, patient point of view always should be noted. Eye care is very, very important because infection is very easy to catch here and can create a problem. So it will help in relieving pain and discomfort, will prevent, of course, infection. It can also help in further problem of injury, right? If any disease is taking place, so we can identify early, so this will help. So again, how to do? Good comfortable position should be given, right? Whoever is giving care should wash hands thoroughly. Cleaning of eyelids from inner canthus to outer canthus is essential, and one swab for one stroke. That is essential. Care of nose and ear, you have to watch for any wax impaction, any other infection. Many times dandruff also can create problem in the ears, right? So one needs to see to it that it is not falling in the ears. So cleaning and how to clean with the buds and gently cleaning is essential. And it, impaction of wax can lead to hearing problems also. Right? So whenever such problem is seen, first inspect the ears and problems are there or not. Nostrils also need to be cleaned properly, especially when the patient is on NG feeds. Yeah, because the crust formation will take place and fissures will take place there also. So cleaning and then applying moisturizer. So that is good. And of course, the change of the band-aid when NG tube is fixed over the nose. So care should be taken. Nail care is very, very essential because many times patients lying in the bed will go on scratching. Right? So if the nails are long, then you had it. Okay, so always be careful about this and how to do about it. So warm water, dip fingers into warm water, use some drops of shampoo so that will soften the nails, and also it will help in removing the dirt from the nails, and then go slowly about it. After cutting, filing also is essential, and so that you remove the rough edges and then they don't have problems. Especially in old age, we have to be very, very careful because their nails become very thick. So cutting creates a lot of problem. Sometimes they get injured also. So if can't do it, then always take experts' help. Exercise has very good effect on our body, right? So it has advantages on all the systems, right? So giving exercise, whether active or passive, is very, very essential. Be it musculoskeletal system or cardiovascular system or any other, right? So one has to be whenever possible, give exercise and advise the caretaker also to help the patient in doing so. Okay, so some important points here are given how it helps on different systems. On musculoskeletal system, it will help in maintaining muscle tone. It will keep the joint mobility in good condition. It will prevent the complications when patient is in bed for long periods like foot drop and all. Right? In cardiovascular system, it will help in good blood circulation, prevent DVT. It will have it will prevent varicose veins also. It will help in reducing edema. So very good to for patient to do some little stretching here and there. It will improve metabolism. If the person is obese, then it will help in maintaining weight, reducing weight. Excretory system will also get stimulated. Okay, and person can have good urinary functions. It will also help in reducing the constipation, and bowel movement will be easier. So that is also very helpful for our palliative care patients. Of course, it has good effects on respiratory system. Deep breathing exercise and control breathing are very good even for anxiety. So that should also be taken into consideration. It will also provide relaxation. It will prevent depression and boredom. It will help mm, a way to outpour the emotional tension. So many things are beneficial about exercise. How to do sterilization at home? This many times it might have come. So once again, we can go through it, right? How to make homemade saline. So 1 pinch of salt in 1 glass of water. It will depend how much saline water we want. Right? So depending on that, we can sterilize. And in 1 liter of water, if it is taken, then 2 teaspoons and then boil for 20 to 30 minutes and store in good container, clean container. That is also very essential. For dressing material, steaming. We have to cut the, as per the dressing area, how much is the dressing area. Depending on that, they can cut the either gauze pieces or gauze pieces are not available, then they can cut even clean cloth also. Right? So all old clothes which are washed thoroughly and sun dried, that can be used. So cutting and then keeping in a vessel. So over a mesh they can place, right? So that the boiling water won't enter in the cloth pieces. And if they are doing in a cooker, then not to place the vessel over it. So in that way, they can sterilize at home. Again, boil for 30 minutes and then keep in airtight container. When patient, there is tendency of bleeding, especially in the fungating wounds. So in them, what is done is use dark colored clothes, okay, especially to cover the wound and cleaning also. Otherwise, if we keep light color, then looking at the amount and color, the patient can also get frightened and the relative also. So always keep the dark colored clothes which can be used immediately to cover the wound. And of course, teach them about proper disposal of waste material. For us in the hospital, it is very easy to discard, right, and use color code. But what if they are at home? So generally what they do is burn them, right? If the facility is available nearby hospital, then they can discard in the hospital also, if they are allowing. So all the situation should be, the points should be noted and then advised. What if the patient is having problems in the excretion? Okay, if the patient is having urinary catheter, so generally Foley's catheter is used in most of the patients. Okay, so while inserting, one has to see to it that it is a sterile procedure, right? And these are other different catheters which are used. So red rubber catheter for intermittent catheterization. Many times patient themselves they do, right, at regular intervals. So such catheter can be used. If the patient is on catheterization for a longer period of time, then silicone catheter also can be used so that there is no frequent changing. Condom catheter is also used. So all the catheters will have their advantages and disadvantages. So depending on patient's need, we have to use the type of catheter. Okay, there can be other methods also of removing the urine, right? Like suprapubic catheterization. as per the patient's condition, it should be used, method should be used. So what to remember? First, adequate intake is very essential. Minimum of 2 to 3 liters in 24 hours, unless it is restricted. Okay, unless water intake is restricted, this should be remembered. Then good perineal hygiene is very, very essential. So here mild soap and water are used to clean the perineal area. And if the patient is on catheter, then how to do it? So many times if the patient is mobile, patient themselves are also taking good care of themselves. Only we have to advise them how to go about it. Okay, so regular care is very essential. Bladder habits, especially if the patient is able to go to toilet, or patient maybe is able to do self-catheterization, right? So regular intervals, it should be emptied. That is very essential. If it is collected in the collecting bag, so emptying of it is also very essential. Maintaining of hygiene of the caretaker is also essential. Otherwise, they will also land up in the infection. Okay, so that should not be the case. Changing of catheter, we know that it is, if it is the Foley's catheter, then it is once in 3 to 4 weeks, and if it is silicone catheter, then it is once in 3 months. But of course, we have to see to it that there are no deposits in it, there are no signs of impaction in the catheter or the urinary bag or the extension tubing. So whenever any complaint is there, many times patient may be in contact with you over the phone and they may describe the complaints. So at that time, you need to ask them whether there are any deposits or there is any color change of the urine, or when the last bag was emptied. Many times, because of the bacterial reaction, the bag can become purple also. Right? So such thing always should be noted. And many times before this time also, catheter needs to be changed. So these points are very, very important. Whether there is any leaking, or bladder is going into spasm, then also a problem. Right? So any leak also should be noted. Always remember to keep the urine collecting bag below the level of the bladder, so that easily with the help of the gravitational force, the urine will be collected. When we are introducing, we have to introduce it up to bifurcation, keeping in mind all the aseptic technique points. And once the urine comes out freely, then inflate the balloon. So for inflation of the balloon, insert 10 to 15 ml of sterile water. So that should be enough, not to insert too much, or otherwise it will have always, patient will have pressure, feeling of pressure at the meatus. So that should be seen. Fixing of the catheter is also need to be carefully done, because many times the adhesive tapes create a lot of allergic reaction, especially when the patient is having catheter since very long time. So that is needed to be taken care of. Self-catheterization, how to go about it, should be taught to the patient clearly. Maintenance of privacy is important here also. What position to be taken, what size catheter should be used, lubrication of the tip before insertion. What is the time interval? So fixed time interval also is essential, so that there will be habit forming. So it is important. and cleaning of it after the cleaning of the catheter after use. And during procedure, they can take help of mirror. How it is important, self-catheterization, it will improve quality of life. It will have, patient will have confidence and increase self-esteem. It is easy to use and inexpensive. And of course, it will reduce the risk of infection also. And it improves, of course, sexual life. Condom catheterization, very many times it is done, but we should know the what are the advantages and what are disadvantages. Many person can have allergy to the material that is used in condom, so that should be seen. Any skin or irritation or any breakdown is there, then always look into the matter and change the method of the catheterization. When they should approach you, okay, whenever they are feeling any bloating or pain in the belly area, or have any blood in the urine, or there are any deposits in the bag or in the catheter, the extension tubing, if it is blocked, what is there, whether it is smelling bad, right? A patient is developing fever, any itching, any rashes. So always these things should be reported immediately. So caretakers should be told so. Perennial care we just saw, so we'll not go further. How to clean in the case of the males, foreskin always need to be cleaned properly so that there are no infection there. Right? And in females, separation of labia majora and minora during cleaning is very, very essential. What about bowel care? Regular bowel emptying is very, very essential. If patient has constipation, he can have many problems. So this should never be taken lightly. When patient remains in bed for longer period of time, there is always an issue about this. Many times relatives will tell that the patient is not able to take food, then how stool will come? But it is not so. We always, there will be some or the other amount of stool present. So what diet he is taking, when last he passed his stool, what are the different medications he is taking, what is the environment, whether he is able to get enough privacy or not, what is his metabolic condition, any structural abnormalities are there or not, any neurological problems are there or not. And all these points should be assessed when we are collecting history. Whether patient is having nausea or vomiting, excessive gas formation, rectal fullness patient is experiencing, using too much of laxatives or what, any painkillers which are causing constipation. So all these things should be assessed in the patient's case. How to go about in the case of constipation? Okay, so always see the causes and correct the correctables. That should be the first line. Okay. Many a times we may have to use laxatives judiciously and stimulants also, especially in the case of opioids. So most probably you will find use of cremafin and plus dulcolax. Right? So that these two are the most common, and that should be used regularly if patient is having constipation. Many times what patients do is when they get constipation, then only they take. So few days they can pass easily, then they will stop. taking it. So again, constipation will develop and then again they will start. So that should not be the case. Improve their general conditions, how they are taking diet, what they are taking. Through diet also many problems can be solved. So that should be done. Any symptoms are there, other things, problems along with that. So that also can be controlled. Activity should be always encouraged, and of course the diet. So in diet, sources should be whatever is available locally. Right? So we should always remember what is available locally and how they can go about it, in which all things they can use the sources, what all recipes they can make. So such things can be told, because they many times they get very uh, bored by eating one ingredient only. So one ingredient, but how differently they can be used in different recipes. So they will always enjoy that. Non-pharmacological measures. So assess the ability to go to toilet. Can be used. What are the timings? Privacy is getting or not? Many times they may not be getting enough privacy, enough time also, position also. So all things should be assessed and then given advice. Many times if the patient is in the bed, then they can keep their feet under the knees and gentle blowing they can do. So it will initiate the, stimulate the intestines. Arms resting on the encourage normal balanced diet and plenty of water. Education to the patient family. Okay, so these questions I told that it should be advised. Many times patient may complain that he is having diarrhea, but actually it may be spurious diarrhea. Right? So when there is a blockage at the lower end of the anus, the stool, liquid stool which has formed above it will pass through the sides of the walls. Okay? So that is known as spurious diarrhea. So in such cases, we need to do the digital examination, and if you find the balloony rectum, then give high up enema. Okay, so that should be. In pharmacological management, softeners are used 15 ml up to 3 times a day. Many times, many patients require. Stimulant laxatives like bisacodyl can be used 1 to 2 tablets, up to 4 tablets you can go. So that can be used. Osmotic agents like lactulose can also be used. So finding out the cause of constipation is very essential. What if the patient is on nasogastric feeding? Right. So ideally 150 to 200 ml of diet should be given every 2 to 3 hourly, unless patient is in terminal phase or patient is denying continuously, then not to force. Okay, because many times end of the life stage, there is not much requirement of the nutrients. So in our scenario, we may feel that patient is not eating and we are not able to do anything. But in such cases, patient's need will be reduced. Okay, so not to force at the end of life time. Avoid air getting or air trapped into the tube, otherwise it will cause gas problems, right? Bloating. Okay, keeping the tube patterned, how to go about it after feeding. Always keep water through it. Many times they forget to give adequate water. They feel, relatives feel that only diet should be given. Total fluid intake may go down, water intake. So that should not be the case. Apart from the feeding also, food can be, water should be given. So that's all for today's discussion. I hope I covered all the points. If you have any points for discussion, we can go about it.
Thank you, ma'am. Thank you for such a wonderful presentation. Participants, if you have any doubts, you could unmute from your end. Either you could use the chat box. Any questions? Ma'am, if there is no questions, I think we can move to the case presentation. Today we have a case from Ms. Ashwati K.V. Nair. Ashwati, can you present it?
Yes, ma'am.
I can share the screen for you. Please go with the presentation. We have shared the part of wound management in this case already. I think Anna ma'am was there when we presented this case. Today we are going to discuss on the other aspects of this case. Ashwati, you can start now.
Next page, ma'am.
Ashwati, you are muted.
Oh, okay, ma'am. So sorry.
Okay, please go on.
Okay, my patient, 72 years older, male patient. He's diagnosed with pressure sore and aspiration pneumonia, type 2 diabetes mellitus, hypertension, feared in old CVA. Now, present complaints of bed sore of forced CVA, complaints of cough, complaints of reduced response of speech. History of illness, he was admitted to nearby hospital with complaints of decreased response and inability to move all four limbs and inability to speak. He was diagnosed with CVA, hemorrhagic stroke, and was treated for the same. He is a non-diabetic hypertensive with CAD, not on regular treatment, bedridden since December 2021. By the examination, patient on bedridden respond to sound and pain. On feeding tube, catheterized with the Foley 16 with the favorable urine output. Temperature is normal, respiration spontaneous, circulation peripheral pulse well felt. Bed sore 3 in number, 1 sacral and bilateral gluteal region. Treatment, patient was admitted and started on IV injection peptides and other supportive measures. Surgery consultation was done, necrosectomy was done. Tissue culture and sensitivity, moderate growth of Acinetobacter. The blood examination HB 10.5, urea 91, creatinine 1.7, sodium 132, HbA1c 6. Medication, injection peptides 4.5 gram IV BD, injection pando 40 mg IV start, regular cleaning and dressing. He is already on Taber isolizine half BD, Taberosagol 10 mg HS, Tabelaverdilor 6.25 mg BD, Sindadopa plus half Q6H and spironolactone OD. Psychological accepts concerns of family members about his health, the financial crisis and loneliness. Main concern, fungating wound, concern of family members. 74 years old male with pressure sore treated with regular cleaning and dressing. Discussion points: wound management, psychological support, support to family, and community engagement.
Thank you, Ashwini.
Thank you.
Anna ma'am.
Yes. So,
Ma'am, can you please go with the case presentation discussion points?
yes. Particularly, we need to discuss about the catheter care, right?
Yes, ma'am.
Yes, ma'am.
So, what to do about the catheter? Right, patient is having Foley's catheter, right?
Yes, ma'am.
So 16 number. So what all we will remember in catheter care? First, when we are introducing, so it should be aseptic technique, right?
Yes, ma'am.
So that should be always remembered. Now, Foley's catheter is there, so there will be change of catheter also once in 21 days or at least once in a month. So that record also needs to be kept when to change it. Then what will the patient's relative watch for? So it will be amount, how much amount is coming out in 24 hours, right? Whether color is, how is the color? Color and consistency. That is very, very essential. And from color, if it becomes very dark, then we can say that intake is less. Right? Of course, we need to see to it that the medications which he is receiving, that also any medicine is there which can change color. Okay, so that should be seen. So color is very, very important. Then the sediments. So if there are any sediments are there or not. If sediments are there, then it shows that there can be infection. So again the color of sediments, how are they? Some pus cells are coming or not. Sometimes it may happen, bleeding is there, then it will appear pink color. Right? So that also need to be observed. So color of sedimentation and how are they? Because if once the sediments start coming in the tubing, then what happens, though the lumen of the urobag, the collecting bag is large enough, but they will settle down. So they can block the catheter. Okay, and there will be backflow of the urine, or there can be more infection in the patient. Okay, so that also to be seen. If necessary, milking also can be done so that the sediments will go all of the sediment into the collecting bed. So that is very, very essential. Sometimes there can be color of the bag can change into pink, right? Then we need to talk to the doctor. There are certain bacteria which causes this color change of the, that is known as purple bag syndrome. Okay, so that also should be seen. Any catheter, pericatheter leak is there. So that can cause, though the patient is on catheter, what will happen? There won't be any collection in the urobag, but patient's bed will be wet. Okay, so that shows that there is leaking. So what is the cause of the leaking? Whether the connection is loose, or sometimes the patient might have pulled the catheter, so that can also occur. And there are other causes also. And so the bladder would have gone into spasm, so that can also cause pericatheter change. So what is important is that though patient is on catheter, all these things are remembered. Then position of the urobag. Okay, always it should be below the level of the bladder. Many times this is forgotten. What relatives do is that keep the they will keep the urobag along the patient in the bed itself. Okay, but that should not be the case. Always keep it hanging below the level of the bladder, or they can place it in some vessel. Right? Put the bag, collecting bag in some vessel, some small tub, and on the floor. So that will also help in collection of the urine with the help of gravitational force. Okay, so that should be same. And perineal care is very, very essential. In case of male patient, it should always be seen that the foreskin is, the catheter is pulled little bit, and then the foreskin is clean. Because many times in the skin folds, the bacteria will they will grow there, and patient can develop infection. So this should also be taken care of. Fixing of the catheter to the thighs becomes another problem. Many times because of the season, the person is having a lot of perspiration. Sometimes in the case of gents, there may be hair present. Okay, so sticking of the micropo or adhesive can be a big problem. So there also one need to see that to change the site of the sticking plaster is essential, and stick in such a way that the catheter is not too tight. Okay? Because otherwise you will have problem while turning the patient also. Right? While turning also, and while doing bedding or like that, the caretaker should see to it that the catheter doesn't get pulled off. So these things are very much essential. Right. Anything else anyone wants to share? So looking for the all the characteristics of urine, normal urine, color, consistency, amount. It is very, very essential. Whether the patient is healthy or unhealthy. More to watch for in unhealthy patients. If the patient is able to go to toilet, not a problem. But when the patient is on catheter, then a lot of things to watch for. Any question in that?
Any other questions? If you need any clarifications on the case, you can ask her. Ma'am, there are a few comments on the chat box, like physiotherapy is important. Change position in every few hours.
Ideally, change in position every 2 hours is essential. So that goes well with the patient's condition. Yes. Physiotherapy is also important. Yes. Okay. Now other thing is regarding the nasogastric tube feeding. Right? Patient is on nasogastric tube feeding. So what to do? When patient is on NG tube, what we need to remember? When we have to give food to the patient, we need to find out that NG tube is in the stomach. right? So that is one thing. It should not be pulled out, right? Especially when the NG tube has come out, always that query should be there, right? So again, inserting, just not to push it, because it can go in the, instead of uh, stomach, it can go into lungs also, right? So in trachea, I mean, right? So this should be taught to the patient. Then while giving feedings, one has to see to it that many times, because of inability to move the patient, they are not able to digest, right? So when, before giving feedings, we have to aspirate. If the aspiration is more than 30 to 40 ml, then it is not, meal should not be given. How to prepare meals and all that should be taught to the relatives. So that is very essential. The menu should be prepared in a proper way. Sometimes patient, always he is on RT feeding, so he will not have any kind of taste of it, right? So you can place one drop of the food, prepared food, on his tongue. So let him taste, right? So that will help in good salivation, and ultimately it will help it improve their good, stimulate the appetite also. It will help in digestion also. So that care also should be given. Regular feeding, yes, someone has written regular menu should be prepared, so that is always there. And whatever menu he was able to take by mouth can be maintained. Right. So it should not happen that all 4 times it is prepared in large quantity, and all 4 times he is receiving same diet. So that should not be happening. Keeping all the equipments, whether it is syringe or whatever equipment they are using for feeding, should always be kept clean. That is very, very essential. Mouth care is very essential. Right? We just saw that when the patient is on NG feeding, patients will develop dry mouth, halitosis, right? So that should be dealt with. When we are giving feeding, always remember not to uh, have any air trap, right? Otherwise, it will block also, and it will, air goes into stomach, then it will cause gas formation. Right? So that should be avoided. After feeding, not to forget to give water, right? Whenever you are giving feeding, keep the head high position, right? So that it passes, food passes easily, right? Not to give in a straight supine position. So these things are important while we are giving NG feeding. Many times the tube becomes very dirty, right? So what to do? We do advise them to pour soda in it 15 days or so, once in a week or in 15 days, they allow soda to pass through, right? So it will clean the tubings. Otherwise, tubing will become very yellow and all colors you will be seeing, and extra infection also. It will block and all that. So we give advice of passing soda. simple lemon soda, not the Coke. Simple lemon soda, so that can be given.
Any doubts from the participant side? There are a few comments like do not feed in lying down position or in adequately
Yes.
upright position. I think all of them were mentioned in ma'am's presentation and discussion points. Thank you, Anna ma'am. Thank you for being with us. Thank you for that wonderful presentation and discussing today's case presentation. Thank you, Ashwati, for your case.